Hey everyone, Dr. Luke Peterson here, physical therapist with the Knee Replacement Therapist. In this episode of the Knee to Know Show, we're going to talk about the question of can you play sports after knee replacement surgery? So, before I jump into that, be sure to hit that subscribe button and turn on the notifications so you can catch all of our latest videos related to knee replacement surgery. When it comes to sports after having a knee replacement, there's definitely some sports out there that you can play, and you can play them safely and in a way that is using common sense, using logic, and doesn't do too much harm or too much damage to that new knee. Now, you definitely want to avoid sports that include a lot of high impact, a lot of high stress on the knee joint. That's things like a lot of twisting and cutting, any type of jumping, so things like soccer, basketball, football. Those sports are going to be a little too intensive for the vast majority of people to play after knee replacement. But there are plenty of sports that, with proper modifications, that you can get back into. So things like tennis, things like golfing, swimming, jogging even for some folks, downhill skiing or cross-country skiing. All of these things within proper modifications, within reasonable limits, you can get back into after surgery. Now, I always tell people, if you're someone who didn't really do these things before surgery, then getting into them after surgery is going to be rather challenging. So you want to have a baseline level of some physical activity and some experience with these different sports. And just start slow and progressively increase how much you do. I always use the example of someone who likes to play golf. You don't want to start and play 18 holes as the first thing you do trying to golf after having a knee replacement. Start by going to the driving range for a little bit, and then start by playing 9 holes and using a golf cart to get around. And then slowly increase, maybe you play 18 holes with a golf cart, and then maybe you walk the 18 holes if you're really feeling up for it. So slowly, progressively getting back into it. Same thing for tennis. Start with doubles tennis, and maybe you just stay with doubles tennis from now on, and that's perfectly okay. Really, the main thing is just use common sense. Listen to your knee. If you do an activity and it really flares it up, really causes a lot of pain, stiffness, swelling, discomfort, then maybe you got to ease off of it a little bit. Do something to modify your activity, do a little bit less intensive, a little bit less frequently. Just kind of listen to your knee, listen to your body as you go along. And just be smart about the frequency. It's not necessarily that you do these sports, it's that if you're doing it a really high frequency, so multiple times per week, long time whenever you do it, that builds up over time. And, the longevity of your knee replacement, you really want to find that happy medium where you're doing physical activity, you're doing exercises to help maintain the strength, maintain the stability of your knee, but also not too much where you're causing that increased stress and increased rate of breakdown as well. So a lot of guess and check, using moderation, using common sense, working into it slowly. I hope this helped answer your question. If you have any other questions or comments, be sure to leave them below. Again, be sure to hit that subscribe button so you can catch all things knee replacement surgery. Thank you very much for watching.